Hello, my name is Diana Karamakoska, and today I will be talking to you about types of documentation. Documentation is a written form of communication, and all health professionals must ensure that they document all of the necessary information pertinent to a client's case, history, and treatment and/or outcomes. The notes must be accurate and must not omit any information whatsoever. They must be reflective of the situation as well. And it has to be relevant information to the client's case. It needs to come from an objective point of view without any biases stated from the health professional. And it should give examples where they are called for. Do not criticize the client or the other recommendations that health professionals make in their communication to you. And avoid using abbreviations that some people may not be aware of or that are uncommon in certain organizations or health fields. And make sure you use person-centered language. Your notes should be centered around the client as they are your first priority. Clinical documentation is a lot more specific to the health professional and what they are undertaking with the client. It's a written record of the patient's assessment and progress, as well as any written reports, referrals to other health professionals, discharge summaries, and correspondence with external agencies or departments. The language used in clinical documentation might be more formal and speaks to the relevant audiences of other health professionals who may be working in a similar area. Non-clinical documentation, however, changes the language so that we are more general and use less scientific terms than what we do for clinical documents. They are written reports using lay terms. They can be referrals to other health professionals who are outside of our area. It can also be correspondence with external agencies or departments. Service plans may also be included here, where a plan has been reached amongst a team of health professionals to best determine the next action or phases for the client's best interest. Performance reviews are also included here so that whoever reads them is able to understand how your performance was and what was involved in the review process. In addition to the service plans are the evaluation plans that follow up once a service has been completed or is in the final stages of completion. And finally, grant proposals fall into this section as well, because they are typically submitted to people who will review them that are outside of your field and need to be generalized and easily understood. So what should you document? You need to outline the details of any assessments or interventions that you have chosen to work on your client with, and also provide supporting evidence as to why you have chosen this method. You should also document and include any letters or emails that are sent out as correspondence, as well as telephone conversations. And this can be summarized at the end of the call or throughout the call, letting them know that you'll be taking notes for future reference. The same goes with any audio or visual recordings of your sessions with a client. You need to obtain consent from them prior to any undertakings of these methods. Also note any absences in which your client has missed a checkup or a session with you. It is also worthwhile documenting the supervision records between staff. This will allow any staff member to refer to these notes to determine who is in charge and also who is operating within the organisation that day should an issue arise. You should also note down the outcomes of any team meetings. This will keep people on track to continue their roles as well as staying committed to the team and the overall goal of the team. And finally, you should document any events relating to the client outside of the client's scheduled appointments. This can occur when they come in to see you and discuss items that would have eventuated outside of the appointment that are relevant to why they have come in to see you today.